Good afternoon. Welcome to the daily briefing at the St. Clair County Emergency Management Agency. We thank everybody for joining us in on this Sunday afternoon. As we said yesterday, today we wanted to do something a little different, a little question and answers. We've had several questions that were sent in to us throughout yesterday and this morning, so we'll be getting to as many of them as we can today. Before we get into that, I want to welcome back Samantha Bierman from the St. Clair County Health Department with the current numbers. Welcome, Sam.
Thank you. Thank you for having us again today. Before I report our numbers for today, I would like to preface with the numbers that we report daily during these briefings are what is reported up to the time when we start. These numbers change minute by minute, hour by hour, so just keep that in mind when you're looking at other websites, Illinois Department of Public Health. Results come in minute by minute, so those numbers can change. As we have reported in days past, all of our totals are for St. Clair County residents that have been tested. We are currently at 253 people tested, 29 positive, which is an increase of 5 since yesterday. We have a male in his 30s, a female in her 60s, a female in her 50s, and 2 females in their 30s. We have 165 negative tests, 59 pending, and as of today, we are reporting 2 deaths, which is 1 new from yesterday. It is a female in her 30s who did have underlying health conditions. One thing I would like to circle back to, the 5 new positives that we had today were all community spread, which means they have had no recent travel within the past few weeks. Our state totals are as follows: 27,762 have been tested, 4,596 positive test results, which is an increase of over 1,105 since yesterday, and we are at 65 deaths, which is an increase from 18 yesterday. As we had said, the numbers don't lie. We are clearly still rising and we have not hit our peak yet, so we are asking everyone to still take very seriously the shelter-in-place order that has been put out and social distancing. One other thing I would like to touch on before we move into our question and answer portion of today's briefing is that over the weekend we had been alerted that there was a false post made regarding the emergency department at St. Louis University Hospital. As a reminder, we would like to put out there that not everything you see on social media is the truth, and we ask for your help in stopping the spread of false information. Please don't share any stories or posts that you see that could add fuel to the fire of untrue information. There are reliable sources if you would like to share information on your social media pages, and those can be found here with the daily briefings that are done by EMA. You can also find current information and reliable information on cdc.gov and coronavirus.illinois.gov.
Thank you, Sam. We appreciate that information. Those numbers are staggering, and as you said, they're going to continue to rise, unfortunately. Our condolences go out to the 1 death from yesterday, to the family and to the healthcare workers that was taking care of the patient. We want to get into the question and answer portion of the day's briefing. We've asked the Assistant Director, Brian Whitaker from EMA. He's going to be asking the questions, and we'll try to get the appropriate answers for you. Brian, welcome.
Thank you. The first question that we received was, I noticed today when riding by Lowe's, it was packed there. Does this go against the stay-at-home order and social distancing?
So people need to fix things in their house. If they need to fix the toilet, they need to do improvements that they're working on. Those type of things, I don't believe we want to encourage stopping. I think people need something to do, and so going to the hardware store to be able to continue to do things around your house is important. But when you're at the Lowe's or whatever hardware store you go to, or the grocery store, make sure you're practicing good social distancing. Wash your hands before you go in. Use hand sanitizer when you come out. Continue to practice the good hygiene when you're out in public. You're handling goods that other people have handled. You're in an environment with shopping cart handles. You want to make sure that you wipe off the shopping cart handles, and if not, put something in between your hands and those handles just to make sure you're not spreading or having germs spread to you.
Well, I think it's worth mentioning too, the governor just sent out executive order yesterday to the retail merchants following those same procedures that you're outlining, Chairman, to practicing the social distancing. So yes, if you're in there and you see that, yeah, mention it to one of the managers if that's what it is. I mean, they have to be responsible for what's going on there.
Thank you. We know that, second question is, we know that patients can still be infectious even after recovery. With the mild cases not being tested and isolated, is there a chance that we will have a second wave after the shutdown is lifted?
It's very possible that we could have a second wave. We will take guidance from the Illinois Department of Public Health on how to handle the situation. With that being said, that is not going to stop. We would still encourage everyone to practice good hand hygiene, practice social distancing for a period of time. We won't know what those guidelines are until they come out from IDPH, but we ask everyone to use common sense and, to continue to wash your hands and make good decisions.
And it's pretty clear that we haven't seen the worst of this yet. It was maybe a week ago that we were sitting here with 3 positive cases in St. Clair County, and that remained consistent for a couple days. Now we're up to 29, and so this is going to go on for a while. We're not through this first phase yet, and until we get through the first phase, we're really not going to know about an upswing that's going to come later on. But however it is, we're only going to solve this by listening to our medical professionals. Whatever they tell us to do, that's what we need to do to be able to make sure this is as short-lived as possible.
Thank you. Next question is, I follow the EMA page daily, and I've noticed a decrease in the amount of information on other emergency calls. Do you think that is due to the virus?
Yes, I think that's is part of the reason. I think the last statistics that was provided to me is we're down about 18-19% of those calls. But again, we understand people's going to be getting cabin fever, and that's why we're telling people stay home and find something to do. But I would say yes, that's got a lot to do with the decrease in those calls.
Okay, thank you. Next question is, do you have any idea when testing will be more readily available?
We heard the governor had a press conference earlier today. Every day that this goes on, more tests are issued throughout the state. The capacity becomes greater. The governor announced that he's hoping they'll be testing 10,000 per day from now on. And every day they're accessing more and more tests because more and more people need to be tested. And then after a while, the new tests are going to be to give blood tests to see if people have already had the virus. And that'll be the next phase of testing, that even if you don't have symptoms, people will be tested to see if they've had the virus, to know if they're going to be immune or if they are immune to the virus in the future.
Okay, thank you. What happens if St. Louis hospitals start getting overwhelmed? Is there a plan that they would send people to Illinois?
So we are a regional medical system. All our hospitals work together. BJC actually is the parent of Memorial Hospital in St. Clair County. HSHS with St. Elizabeth's, they work together. Touche Regional. We're a regional network of hospitals, and if this crisis becomes too much for the capacity at the hospitals, then they may be looking elsewhere. They may be looking to put up tents, all sorts of things that are being done elsewhere that really haven't been recommended here yet, given the numbers that we have. But certainly the capacity is there if we need to expand to make sure there's enough health care to take care of this crisis in this region.
Well, I think it's worth mentioning, Chairman, we've had numerous calls with the presidents of both St. Elizabeth's and Memorial and Touche Regional Hospital, and they are all working together, coordinating efforts, keeping in contact with your office and the EMA office, and it's a regional approach that we're doing here, and I think that if something of that magnitude goes, those people will be able to lead us in the right direction.
And it's the reason why we're social distancing. It's why we ask that you not go to the emergency room if you have symptoms, but to call your medical provider first. We're trying to keep this spread from reaching a peak level, to level out at a manageable level so we have enough medical personnel to be able to handle this issue and move through the system. If everybody does what they're asked to do, if they stay in place and they practice good hygiene, we hope that we're not going to get to that peak level that's going to cause those type of issues with an overburdened medical system.
Okay, thank you. Who makes the decision if and when someone should be tested?
Testing guidance is put out by Illinois Department of Public Health, and that is passed down to the whole state. So IDPH they make the guidance for those who get tested, and we simply follow that guidance.
Okay, thank you. Staying here, Sam, if a minor child needs hospitalization, are parents allowed to stay with them?
They are. While hospitals have put a ban on visitors, there are certain exceptions. The exceptions are for patients that are at the end of life, people that are in labor and delivery, and pediatric patients, so patients under 18. There have been specific exceptions made for those patients to allow family in with them.
But is it also true that those visitors are being screened, taking their temperatures at some of the hospitals?
I believe so. Each hospital may be different, but I do know that they are looking at individuals that come in as visitors. They're taking the highest precautions that they can to make sure that everyone is staying safe.
Thank you.
The next question is, I work at a gas station and I frequently see things I know shouldn't be happening. Children in the store at all hours while their parents wait in the car, several customers coming in multiple times in the same day, or customers trying to come in large groups. What is being done or can be done to protect the essential employees?
Well, protecting the essential employees is something that starts with the management of that establishment. You working there as an employee have all the rights in the world to bring that to your supervisor or the manager. We have been in contact with all the communities in the county, from the mayor's office on down to the law enforcement. And every time we receive any type of information like that, we've been forwarding that on to that local municipality. And I got to say that our conference call that we had the other evening with the mayors and the chiefs, we have seen positive impact where they have been out doing more proactive enforcement of that. And my hat's off to all of them because our first responders are taking this real serious. So if you're working at an establishment like that, you're all within your rights to bring it to your supervisor and tell them that you're seeing this go on and see what precautions that they are taking to protect you as an employee.
Thank you. What is the risk exposure to outdoor workers, such as landscapers, lawn mowing crews, if they keep their equipment sanitized throughout the day? Are there any other precautions they should be taking?
Social distancing, be out there. You've already said, you're sanitizing your equipment. That's a great thing, but don't be around large groups. Practice that personal hygiene. Take in all that fresh air you can. And just keep practicing what we're asking you to.
Okay, thank you. I'm a transitioning military member who is moving to the Scott Air Force Base in a contractor position. I will obviously be practicing social distancing to the biggest extent possible, but are there any restrictions that would prevent me from moving to St. Clair County?
So you can move to St. Clair County. I would ask that you talk to your superiors or your commanding officer at the base to get guidance as to what the procedure is at Scott Air Force Base. I know they have their security levels have been upped at Scott, and they have specific guidance as to who's coming on the base, who's essential, who isn't. And so I think that your guidance needs to come from your employer at Scott. But as far as moving here, you're welcome to move to St. Clair County, and we're going to all get through this, and we look forward to a new resident coming here and working for the largest employer in this county.
Thank you. Whenever the stay-at-home order is lifted, do you see any type of semi-permanent or extension of social distancing to occur?
I think that, as I said earlier, this is a crisis that's going to be solved by the medical community. So there will be guidance that's going to come as to when a certain date arrives, that the cases start to go down, as to how things can be loosened up. Perhaps the distance apart will be loosened up. I'm sure it will be. The one thing that should not be is we should continue to wash our hands. We should continue to use hand sanitizer and do all of those hygienic things that we've been preaching this entire time about the COVID virus. Go well into the future, and they apply to many other illnesses beyond COVID-19.
Thank you. I just want to make one point real quick before we go on to the next question. We're getting a lot of questions online about the school systems, and I just want to make it known that Regional Superintendent of Schools Susan Sarfati is here with us again today, and we'll be bringing her in shortly to answer some of those questions as it relates to schools. So I don't want anybody to think we're ignoring their questions. We're going to get to them here throughout this briefing. So we'll go to Sam for the next question. Sam, how many people with positive test results are hospitalized versus how many are staying at home?
It's hard to give that number because it's both. As we have heard with a lot of our positives and with the 2 deaths, they have underlying health conditions going on as well. So it's really at the doctor's discretion when the patient can be admitted and when they're ready to go home. So it is a combination of both.
Okay. Staying here, are there any positive cases known to have had contact with each other?
There are, and one thing that I think it's important to mention is that someone could have been exposed to coronavirus by someone who didn't even know that they had the virus. You can be mildly symptomatic and not realize that it is significant enough to possibly be coronavirus itself. So that is why we are pushing to shelter in place and to keep our social distancing to help flatten that curve, which continues to rise. So that is our best suggestion.
Okay, thank you. Next question says, after this ordeal is over, are there any thoughts to St. Clair County making its own stockpile of supplies for any future emergencies?
Well, we have stockpiles of supplies. Sam, through the health department, and us through the EMA department, have supplies that we keep. We keep on hand, but nobody could be prepared for what we're doing right now. We've seen that across the nation. Everybody was caught off. But no, we do have supplies here in St. Clair County. We've shown that through the tornadoes, through the flooding, but we've never ever had to experience anything like this. So we'll do that.
And we rely on the national stockpile. I mean, that's really how disasters are coordinated, and we've done tabletop exercises for a long time with all our state and federal authorities. And it's clear that a lot of times what our tabletop exercise involves is how are you going to be able to distribute the items that we're going to send to you, whether it's medication or supplies. And so while we have a stockpile here in the county to deal with local disasters, which normally are flooding, which hopefully we don't have this year, or other natural disasters, we have supplies for that. When it comes to a pandemic, we do rely on our federal stockpiles to be able to help us through an emergency like this one.
Okay. Next question says, it appears that the vast majority of people are still not staying in their homes. Why aren't there harsher restrictions to mandate they stay in their homes?
Well, the police chiefs, the sheriff, our state's attorney, we've all issued strong guidance telling people to shelter in place, stay at home. You're allowed to go out and recreate, walk around, but you should practice good social distancing. It really is something that we have to be able to tell people, stay at home. And for us to have a penalty out there is important, but really people should understand that people's lives are at risk. They are endangering the lives of their family if they're going out and congregating and coming back home. They could be infecting the families of the people that they're going out with. Stay at home, practice good social distancing, and we're all going to get through this in the shortest time period possible.
Thank you. Should bars be allowing customers to sit down in their establishment even though they're only allowed carryout orders?
Yeah, I think that from what we've read and under the executive order, they can go in and get pickup orders to go, but they're not to be served inside the bars. We had a call the other night to the establishment that there was 30 to 40 people standing outside of an establishment waiting to get their fish orders, and the call was made, and the owners of that business actually went out there and told the people, you have to go get in your cars, you can't be standing around like this, and that's what I call responsible business owners. They took the initiative to go out there and say, look, we want to serve you, but you got to follow these rules. So, but no, to go in and sit down, they can't be served. It's supposed to be to-go orders.
Okay, thank you. The next question is, can you explain how this virus is transmitted from one person to another?
So it is transmitted through droplet. It is from sneezing, from coughing, which is why the social distancing is so important. We are saying stay far enough away from someone so that if someone does sneeze, if someone does cough, any droplets that come from them, you're in a far enough position away that they will not come in contact with you. And if they do, that is why we are stressing so heavily hand hygiene, washing your hands. And if you aren't able to have access to soap and water at the time, using hand sanitizer that is at least 60% alcohol.
Okay. If I am at home living with only my spouse, what are the chances of us becoming infected with the virus?
We can't give you, specific percentages, but, that is the whole point of the shelter in place, is to limit your exposure to others. By doing that, you're giving yourself the best odds to stay safe and healthy.
Okay. And one question I've seen come in a couple times here and was previously submitted as well. What do you recommend about grandchildren visiting their grandparents?
As much as you would like to see your grandparents, we're asking you to continue to socially distance, to shelter in place. Luckily, we are at the age of technology where we have Skype, we have FaceTime. We're asking that you utilize those technologies in the interim until this crisis is over.
Okay. Are we doing any type of contact tracing in St. Clair County?
Yes, we are. Actually, quite extensive contact tracing. Any positive results that we receive back as a health department, we contact those individuals. We find out when their symptoms started, from that point on, where they have been, who they have been in contact with, and then we make all the proper notifications to those individuals and check with them to see if they've had any symptoms, and then it progresses from there if we need to take any further action.
Okay, thank you. Does the county offer any type of assistance for private individuals that have become unemployed?
So a couple days ago, we had the head of our grants department here, Rick Stubblefield, and we talked about that the program to pay power bills of people has been extended. It's now easier than ever to be able to file to get those benefits. We've got a leader in Governor Pritzker who has said that no people will be evicted from their apartments during this, so there are no evictions from homesteads, and also that no utilities will be shut off. So people have a time window that they don't need to worry about those basic needs in life. Unemployment benefits have been extended. The federal government has done that, and there are benefit checks that are going to be arriving very shortly to people. So those type of benefits are out there, and that list is growing. There was a large package that was passed in the federal government. Much of that flows through the states to the local community, and we'll be coming out with more of those programs as they become available.
Okay, thank you. One that just recently came in here says, this morning I was in line at the Sam's Club when it opened. People were not spacing far enough apart waiting to get in. There was large groups of families shopping together, and there were approximately 100 people or more in line. What should we do to better stagger admittance to high-demand businesses like this?
Again, it all starts at the local level, at the establishment, and that is something that, if we get that information through the 911 centers, and we don't want you calling there for that, but post it on our page, and we've been doing that. We've been sending that information to the local communities, and they've been responding back to us. So again, I just ask you to keep in mind our law enforcement, our first responders are handling calls, running day and night. So are they going to be able to drop everything they're doing to run right out there and do it? Probably not. But please send us that message and we'll get it out there. But again, I can't emphasize the local establishment has to take that responsibility. The governor has gave this right for these places to stay open during this pandemic, and we don't want to lose that. And if people don't continue or they don't follow what we're asking, that's a possibility that they would shut them down. And then they'll all be crying about that. So it's a balancing act that we got to do. Stay home. And if you're going to go to the store, keep your distance. Some places we've got reports, they're putting tape on the floor 6 feet apart. Some places they're only letting so many people go down the aisle at one time. That's the kind of things that we want to see.
Okay. Another question that's come in says Memorial Hospital in Belleville is asking for supply donations. Do they have access to the county's stockpiles?
Yes, we've been working with them, as we all know. The president has been here. We've been on the phone with them. Supplies have been in a short in demand. We ordered some 3 weeks ago. Hopefully, we're going to get some in tomorrow or by Tuesday. But I think that as we set up the page where we've agreed to accept those donations that would be coming in, if somebody's got some of the masks or gowns, we'll be more than glad to take them here. On our page it says, they got to be in their package. And yes, we're working with all the hospitals, the health department. Sam the other day made sure all the nursing homes and everything is getting their needs met.
And the other day, you distributed to dozens of departments throughout St. Clair County.
Every department.
Every department came and received masks and hand sanitizer, all those types of supplies. Anything they requested that we had has been distributed, and that's why we're looking forward to another load coming in, hopefully tomorrow.
Hopefully.
Question for Sam here. Can you explain the difference between common pneumonia and the COVID virus?
There's a lot of different factors that play into that. As not being a doctor, I don't want to go too far into it, other than saying that if you have coronavirus, having other underlying health conditions can make coronavirus harder on those people than those that don't have underlying health conditions. But I wouldn't venture to answer that question as I'm not a medical professional.
So
And we're going to have a healthcare.
right, but call your healthcare provider if you're asking that question and you don't know if you have pneumonia or COVID-19. Call your healthcare professional. Tell them what your symptoms are, and they'll tell you what to do.
And I think it's worth mentioning, Chairman, that hopefully starting tomorrow, we'll start having a physician at the briefings every afternoon. St. Elizabeth's Hospital and Memorial Hospital has agreed to have somebody here to give us updates on what the hospitals are doing and to answer questions like that. So please stay tuned for it.
What additional steps can the police take if someone will not voluntarily comply?
Well, our state's attorney has had that conversation with the law enforcement part of it, and the sheriff has, Sheriff Watson. And Sheriff Watson, I think, made it very clear that, they are going to go out and they are going to be reasonable and get people to comply with social distancing. But as he said the other day when he was on the briefing, that if they don't want to, that he's got a place for them. So I think that's pretty cut and dry. If you want to be obstinate about not conforming to what we're asking you to do, all of the law enforcement, all the chiefs that we've talked to. So, and we don't want to get to that point. We want everybody just to do what we're asking, and we'll get through this.
So we'd like to welcome Susan Sarfati, the Regional Superintendent of Schools, who's joined us here on this Sunday to be able to answer questions from parents, from grandparents, people who have kids that are going to school. A number of questions out there. Susan, you ready?
I am ready. Thank you, Chairman.
Okay, welcome.
The first question is there any plan to extend the school outage beyond April 7th?
Well, that's the million-dollar question. Superintendents want to know the answer to that. Teachers want to know the answer, and parents want to know the answer to that. As of this point in time, schools are closed through April the 7th. We expect to hear something probably later this week to determine if we're going to extend that, and if so, for how long.
Okay, the next question that came in was, will decisions be made district by district, or will this be a regional approach to all schools in the area?
I believe it will come from the governor, like the last one did. He had an executive order to close all public and non-public schools across the state.
Okay, thank you. Are there any recommendations you can give to keep children occupied during this extended time at home when some of their freedoms are restricted based on the guidance?
Sure. The World Health Organization just put out a one-page suggestion, a guide for parents to do things other than screen time. We as educators have been saying for years how important it is to limit the amount of time children spend in front of a computer, in front of a TV, doing gaming, and that hasn't changed with this virus. It's still important to limit the amount of screen time that our children have. So if your district is doing e-learning, where they're spending an hour or 2 hours or 3 hours a day on technology, it's really important for them to do things other than spending more time in front of TV. So the World Health Organization has a one-page guideline, and it's also really important that kids get their exercise. Now that the weather's a little bit nicer, we can get outside. Remember what the chairman and we've all been saying about social distancing, but do things other than screen time.
We've discovered cooking again at our house. Our kids are getting engaged with mom and dad, and they're trying new recipes. Yesterday, my daughter made sourdough bread, which was a big hit this morning at breakfast. And so these type of old-time family events, the way families used to exist, I think we're kind of rediscovering
Right.
our past,
Right.
and actually we're going back to a kinder, gentler time, and it's not all bad rediscovering some of these things. We're going to get through this terrible virus, but maybe we'll find a new pastime or two, putting together puzzles, board games, those type of things that have gone by the wayside. Now are coming back into favor during a crisis like this.
And it's really important for parents to talk with their children. Children know that things are different, and many of them are scared. And so please spend some time talking to your child, asking them questions, listening to what they have to say, and it's really important for their mental health.
Okay. Another question that came in that says, how are teachers reacting to the dramatic changes in their learning environment?
I think we're seeing some great things that our teachers are doing. They're being extremely innovative. They're making contact with kids sometimes daily. They're using things like Zoom and Skype with their students. Teachers are planning in a way that they've never expected to plan before. This wasn't part of our teacher prep, using this kind of learning at home. So they're being very adaptive, and they're working together with their grade level team to figure out new ways to work.
Okay, thank you.
And Susan, say one more time your website to give those free resources to use with students during school closures. A lot of it's online, but it's all free, and a lot of it is educational and fun. The more that we can make it fun for our kids, the more they're going to want to stay home, and it's not going to be as difficult to keep them from going out to the playground and getting together with their friends.
And first of all, I wanted to say too, our superintendents and our teachers are planning over the weekend for what things will happen after Monday, because we enter into a new phase of the educational portion. So look for things from your school district to be coming out in the next day or so. The website is www.sccroe50.org.
50.
50, correct.
Okay.
Thank you.
Thank you, Susan, for being here. We really appreciate you coming.
You're welcome. Thank you. Thanks for letting me come in.
Great.
Chairman Kern, another question that's come up here that you might be able to answer. Is the Silver Creek Preserve outside of Mascoutah closed with any type of COVID-19 precaution?
I believe the gates are open as to our last instruction, because they're walking trails and places that people can social distance. We discourage that to be a place where kids congregate, and if we see it becoming a problem, then we'll close the gates and close the reserve. But for now, it remains open because it is a place where you can recreate and not be close to anybody else, and that's what we're looking for in this time.
Okay, thank you. Want to go back to Sam. We've just gotten several questions now that relate to private citizens that are not sick purchasing and wearing their own masks when they go out in public.
With that, as you guys have heard from the very beginning, personal protective equipment is in short supply. It's very scarce, and as of now, IDPH is still not recommending that personal citizens wear masks for two reasons. Number one, with the shelter in place, you should be staying at home, staying away from individuals. And the second reason is that by private individuals purchasing masks, it takes those masks away from first responders and healthcare providers that are on the front lines that truly do need them.
And Sam, we're assuming that those people that are wearing the mask have not been diagnosed positive. They should be quarantined.
That is correct.
They
Anyone
should
that has been diagnosed with a coronavirus positive test result should be quarantining at home for 14 days. That is correct.
Last question that's popped up here was, is there any talk about releasing prisoners in St. Clair County due to COVID-19?
Throughout this, for the past many weeks that we've been dealing with this, the state's attorney's office, the public defender's office, the judges have all been dealing with this. Anyone that didn't need to be incarcerated wasn't incarcerated. There are new protocols at the jail to make sure that people are screened if they're going to be jailed, that they don't display any symptoms, fever, anything like that. Certainly there is no need to go release a bunch of prisoners. We have the levels in the jail at a manageable rate right now, and we hope to keep it that way. But it's because of a concerted effort that's been going on for many weeks to prepare for this, to prepare for the COVID and the spike that we think is coming.
Well, and I think it's worth mentioning that the sheriff and the state's attorney, Mr. Gomrich, has been meeting and got a plan in place that should that situation come up, they've got a plan in writing that can be met and address it.
But be assured, if there are bad people out there, they're not going to be allowed to walk around.
No, exactly. I want to go back. Seems like forever now, everything that we've talked about here has been about seriousness. But I want to go back real quick about your cooking. Do you offer delivery?
Well, not yet.
Or how about
you got to talk to the health department.
DoorDash or whatever it's called. So, that bread sounded good this morning. But I want to thank everybody who submitted those questions today. We hope we were able to answer them. Probably not to what you wanted to hear, but some of them hopefully was right on point. But before we wrap up here, tomorrow we start our day off with some conference calls with the hospitals and EMS, which is done every morning. We'll be waiting for the more hand sanitizer to come in, and hopefully some more of the PPEs that we've had on order will be here. And I'm sure we'll be having a couple other conference calls tomorrow. You heard Sam give those numbers today. One more death, which is one more too many. As the chairman has said, we haven't reached the peak yet. The governor basically says we're not there, and it could be later into April before the peak comes. So we're in this for the long haul. We're going to be here each and every day. And Chairman Karen, again, I've told you this off of the briefings, but your leadership, what we've been doing here is, I think, is just, you've been here every day, every night. Sam, and the other thing I want to say, Barb, I want to wish her well. She had a little health issue, but she's going to be back hopefully, and we miss you, Barb.
And Herb, all of the medical professionals,
everybody.
The EMS, the dispatchers that are working hard, and then everybody in the hospitals that are doing double shifts, You know, some people, they're putting their lives on the line. They're risking infection, and they're doing it every day willingly.
Yeah, that are in there sanitizing the hospital rooms and the ER. There's a list of people.
The checkers at the grocery
Yes.
store. I mean, we've had a number of questions about big crowds at the stores. Well, look who's taking care of you in the stores. All of those people that are working extra hard, stocking the shelves with toilet paper, making sure that we don't have any shortage, those type of things. Those are all people we count on. They are all heroes, and they're the ones that we need to be out there thanking.
We will, and then as we said a little bit earlier, tomorrow we will be having a physician, hopefully daily, from one of the hospitals will be joining us. We will be answering some more of those questions that you'll have tomorrow probably. So we'll be here around 3:30 tomorrow afternoon. We'll be back in just a few moments with our two young ladies to translate this into our Spanish communities. Thank you.